Hi, I'm a nurse at Fox Chase and I'm going to be demonstrating some hands-on skills of how to properly care for your Foley catheter and answer some frequently asked questions. So this is the bag that you have been using in the hospital. So this is the tubing. So with tubing, you want to make sure you don't let it kink. So what you can do is you can have it looped just like it is here on the bed, and then as it comes down to the floor, you want to keep the loops from being below the bed. So just having it hanging like this below the level of the bladder, making sure that the tubing is nice and straight as it comes down will help the urine flow normally. So number one, always want to make sure that this bag stays below the level of the bladder to make sure the urine is flowing properly. And then whenever you empty it, you are going to take this green clip part, you'll squeeze the two sides to unclip it, and then you'll have it over the toilet or wherever you choose to empty your urine, and then just make sure that you unclamp. So you'll have to press down on the clamp portion to release it, and now that it's open, the urine will flow out. Whenever you're done, you will reclamp it, kind of shake the excess urine out, and then just return the green clip to this clear portion to keep it clean. So you'll be going home with a bag similar to this. The only difference is that this clear plastic portion won't be on the bag that we send you home with. And in terms of emptying it, since this is a bigger bag, you'll only have to empty it about 3 to 4 times a day. But a simple rule to follow is empty it whenever you notice that it's getting to about the halfway mark. You want to try to not let the bag get over halfway full. So you want to try and empty it whenever it reaches the halfway mark or earlier. Pause it. So we'll be sending you home with these 2 collection bags. So this is a leg bag. This is used when you go out in public and you're walking around more often, you're more mobile. This will strap onto your leg and it goes under your clothes, so that way when you're out in public, people can't see it. This collection bag is what you will use more often. So because it's bigger, you'll use this whenever you're sleeping, if you're going for a long car ride, if you're relaxing at home and you have your feet up. So the most important thing to remember is the leg bag should only be used if you're going to be up and walking around and you're not going to have your legs up. If your legs are up or you're sitting for long periods, use the larger collection bag, because you have to keep your legs straight in order to use the leg bag, otherwise the urine will not flow properly. Another time you will use this collection bag is when you're showering. So even though you're standing, you're still going to use this collection bag because you don't want to be getting the bag wet. And you'll hang the large collection bag outside of the shower, either in a bucket or on a towel. You don't want the bag to be touching the floor because you want to keep it as clean as possible. Okay, so now I will demonstrate how to interchange between the leg bag and the larger drainage bag. So what you'll do is you'll need some alcohol swabs, and then we'll also send you home with this cup. What we have is we just have the cap that will go on the end of this tubing, just so that way you keep it clean after it's removed. But what you'll do is you'll get an alcohol swab ready, and you will take out this tubing from the catheter. So what you'll do is you'll squeeze the catheter right above the tubing. You'll feel the top of the tubing, but you'll squeeze there and just slowly twist. The tubing might have some urine in it, but that's okay. But slowly twist until the tubing comes out. And what you can do is you can clean the tubing with the alcohol swab before putting the cap on. So then you can just open up this jar with the cap. And since the cap was in the cup, it's clean, so it's okay to just pop it right back on. So now, when you change to the leg bag also has a cap on the top. So we'll take another alcohol swab. Just have it ready. Don't take the alcohol swab out, because what you're going to do is you're going to take the cap off of the leg bag put it in your cup, and you're going to place the top of the leg bag tube in the alcohol swab. And you can wipe it in the packaging, but then leave this in the packaging until you're ready to insert it. So what you'll do is you'll take one more alcohol swab and just clean the catheter portion where you'll be inserting the leg bag tubing. And once that's clean, you can take the top of the leg bag tube out, since you kept it clean, and you'll insert it. So as you can see, there's some lines on the top of the tubing. You don't have to push the tubing all the way in so that the lines are all covered. That will actually make it harder to take out. So just like that. Now the tubing's inserted, and now you will just strap the straps around your leg. So on the leg bags, we have these blue buttons, and that is where you will secure the straps. You don't want to make the straps too tight, but you also don't want to leave it too loose so that the bag is sliding around. So just like that should be good, and you'll do the same thing on the bottom strap. And you'll want to position the bag so that it's a little bit more on the inside of your leg instead of the outside. So you just want to make sure that it's in a straight line with your catheter. You don't want it rolling this way or going around your leg the other way. You just want to keep it in a nice straight line to make sure that everything drains properly. Now these extra ends of the bag, you can feel free to cut the extra ends off. Once you find whichever notch you feel most comfortable with, you can cut the excess off, so that way it is easier to manage. And then when you're emptying the leg bag, unlike the larger bag where it has the clamp and the clear plastic that you keep the tip in, there's nothing covering this tip. So what you'll do is you'll find where you want to empty your leg bag, and all you have to do is just pull this blue lever until it's in this position. When it's like that, the urine will flow freely out of the leg bag. And then when you're done, you'll just push this blue part back so that it's facing the top of the bag. And then of course you can just shake off the excess urine. And feel free to take another alcohol wipe and just wipe the opening after you're finished. So now I'll show you how to change back to the larger drainage bag. So when you're taking the leg bag off, first what you can do is you can just empty the bag, make sure there's no urine left or very little, and you can first undo the buttons here. Once those are undone, you can take your cup with the top of the cover for the top of the urine bag. So we'll take an alcohol swab and just have that ready. And then similar to how we interchanged this larger drainage bag with the leg bag, you're gonna squeeze the catheter at the top up here and just slowly twist until the urine bag is removed from the catheter. You'll take your alcohol swab and clean the tip of the urine bag. And then you can take your cap that you have in the cup and place it over top to keep it clean. And now you can set that aside. And now we will go over how to insert the larger drainage bag. So you'll take another alcohol swab. You'll open it, but keep the swab in the packaging. You'll take the top off of this tubing and put it in your cup to keep it clean. You'll put the tip of the tubing in the swab, and you can kind of wipe it inside the packaging and then leave it in to keep it clean while you clean the tip of the catheter. So you'll take another swab, you'll clean the catheter where you'll be inserting it, and then once you're ready, you can kind of shake off the alcohol, take it out of the packaging, and then you'll just insert the tube into the catheter. So what you've been using in the hospital is called a stat lock. That's the sticky portion that is taped to your leg that keeps the catheter in place. Another option you have is called a flexi track. It works similarly to the stat lock, except it's not snapped into place. Instead, it's a piece of Velcro that keeps it in place. So I will show you how to take the stat lock off and put the flexi track on, and how to use the flexi track. So when you're taking the stat lock off, first you can unclip. So there's a little tab on the side. You'll just push that tab in to unclip, and you can take your catheter out. Don't worry about it falling out. The balloon is inflated, and that will still keep the catheter in place. So when you're removing the stat lock, what you can do, if it's really sticking to your leg, is take an alcohol swab and just wipe the stat lock. And as you're pulling it up, you can kind of bring the alcohol swab to wipe underneath. And once that's removed, you can just let your leg air dry, or you can wipe it again with another alcohol swab. It's up to you. But now I will show you how to use the flexi track. So you'll open the packaging, and this is what it looks like. So similar to the stat lock, it's still something that sticks to your leg. The main difference is that what keeps the catheter in place is Velcro. It's a combination of stickiness and Velcro. But what you do is, there's a portion right here in between the Velcro pieces. So this, if you peel this off, this is the sticky part. So you will place the catheter in that sticky section, and then you'll fold over the Velcro like that. And then once you have it in a place that's comfortable, you can take the tape off the flexi track and tape it onto your leg. your choice to use the FlexiTrack or the Stat Lock. Both are acceptable, but this is just another option for you.